Hello guys, welcome back, and today we will see another nursing diagnosis. In the last class, we had a discussion regarding another nursing diagnosis, that is acute pain, and in this class we are going to discuss about another nursing diagnosis, so that is self-care deficit, and how we'll write a nursing diagnosis for self-care deficit. That we will see now. Nursing diagnosis for self-care deficit, you can write like this: self-care deficit related to fracture as evidenced by inability to perform daily day-to-day activities. So inability to perform daily day-to-day activities could be the sign, and self-care deficit is because of what? Fracture. So for my patient, the situation is fracture in my case. Okay, so in your patient case, that will be different. So what is the reason behind self-care deficit? That you have to write under the etiological section of your nursing diagnosis. So self-care deficit related is very important, related to fracture as evidenced by. That word also important. That connection related to and as evidenced by are very important in NANDA nursing diagnosis. And so you can write the nursing diagnosis like this: self-care deficit related to fracture as evidenced by inability to perform daily activities. And what could be the goal? The patient will start to perform their activities independently through caregiver support. The next thing is nursing care plan. Nursing care plan is very important. While writing nursing care plan, you have to write all these columns: assessment, diagnosis, planning, rational, implementation, and evaluation. Okay. Under assessment, and you have to write subjective data and objective data. Okay. So subjective data means what the patient is saying about the condition. What is subjective data means what the patient or the nurse observing. Okay, so the patient is saying that he or she is not able to perform daily activities. And what could be the objective data? The patient looks dull and tired. Then while coming to the diagnosis, you write the diagnosis what you have written in the previous slide: self-care deficit related to fracture as evidenced by inability to perform daily activities. And what is the goal? The patient will start to perform their activities independently through caregiver support. This objective, if you want to write, it can write, otherwise you can leave it. Okay. Then planning. In the planning, these are all the general planning: do history collection and physical examination. That should be in present tense, and implementation, that will be in past tense. So do history collection, done history collection. Assess the degree of disability, assess the degree of disability. Assess the ability of the patient to eat, assess the patient's ability to eat. Assess the constraints or barriers that prevent patient become active, assessed. Plan and schedule, scheduled. Okay, so in this way you can write the care plan. Okay, then communicate with the patient, communicated. Schedule time for physiotherapy, scheduled time. Provide medication, provided medication. And in the evaluation column, you can write patient started to perform their activities independently through caregiver support. Okay, so in this way, you can write the care plan for self-care deficit. Hope you understand, guys. Next week, I'll come with another nursing diagnosis and care plan. Thank you.